one piece of advice that you'd give to your younger self when you're just starting off?
Let me see, let's see, wow. Do it scared.
Do it scared. I don't think I've ever heard that before. I know it's pretty self-explanatory, but I don't think I've ever heard that before.
Do it scared. All the stuff that I just talked to you about.
Interesting.
Moving to Texas sight unseen, renting a house via FaceTime, right?
Scared.
Don't
I need to
think
get
I
a
wasn't
T-shirt
scared.
printed. I need to get a T-shirt with that.
Don't think that wasn't scary, right? Leaving nursing, and people thought I was crazy. My family, they didn't know what I did until my book came out at the book launch in this March. When I left public health, they were telling people like, we think she inspecting water or going to restaurants or something. Like that's all they thought public health was.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Sometimes, the most remarkable career paths aren't linear. They're shaped by challenges, pivots, and bold decisions. In this episode, I'm diving into the story of someone who started in nursing, transitioned into public health leadership, and discovered new ways to create an impact on a much larger scale. From PHI Media, I'm Gordon Thane, and this is the story of Quisha Umemba.
Quisha, welcome to the Public Health Insight Podcast.
Hi, Gordon. How are you?
I'm very well and excited. We ended up speaking for about 10 minutes offline because I got a little bit excited, jumped the gun a little bit, and just decided to push record because there might be some little nuggets and tidbits that you're missing out on behind the scenes. So we'll get started with things. So here's the first thing, okay? I want to go back down memory lane, okay? I want you to imagine your career as if it was like a Google map, okay? Where you're traveling from place to place, you're navigating through traffic, you're seeing stop signs, you're seeing detours, you're going on a highway, you're missing exits, you know, just the normal things that happen when
That sounds like me driving every day.
Right. and maybe similar to how a career turns out sometimes, right? So if you were to go back and put your starting point as what you were doing in your high school days, how would you then describe everything that unfolded from there?
High school days, wanted to be a doctor. That's first and foremost. I was a candy striper at the local hospital. I worked in a couple of areas. One was surgery, and I knew I did not want to work in surgery or OR. I did, of course, like general med surge, and then I did daycare rotation as well. So they had us kind of work in 3 different areas. But I was so intrigued by the surgeries that I saw and just the conditions that brought people to the point of needing to be on the operating table in the first place. And so I knew I was going to be in the medical field. At that time, I was really into CSI. All those criminal shows. And so I wanted to do something in forensics. And so I thought that was going to be medical examiner.
I love forensics too. Yeah. Criminal Minds, all those different shows.
All of those things, absolutely. And I actually found my application. I had to write an essay to get into nursing school. And I actually put on there, I want to be a sane sexual assault nurse examiner.
That's very specific.
Sane certified nurse. Oh, I'm very specific in my.
Wow.
And because at this time I'd had my son at 19, and then I knew kind of medical school was off the back burner. And so I went through a medical assisting program, and the instructor there said, Quisha, you graduated as valedictorian. You really shouldn't stop here at being a medical assistant. You really should go to nursing school. And so I actually keep my essay that says, this is what I'm going to do, and these are my goals. And so I went from being a medical examiner to a sexual assault nurse examiner. Yeah. And that was it. I was going to be a forensic nurse, and nobody was going to tell me anything. And then somewhere along the lines, I decided I didn't want to do that. So that's the first stop that stands out to me.
You said surgical. Your surgical experience wasn't for you.
Yeah.
What happened?
What about it? One, the smells, I think. So
Okay.
the smells of like using a laser to cut open flesh was just not my thing. And then
Okay.
everything is
Okay.
super sterile. I am the type of person, if I drop something, I believe in 3 second rule. Like, oh, that fell, pick it up, blow it off, And so, and I also did not like, they wash their hands like 10 or 15 minutes
Yeah.
to scrub in and scrub out. And I move too fast for that. I'm like, and
Mm.
to me, it's like, well, what if I don't do the 10-minute hand wash? Am I going to carry something in? So it came with too much
Mm.
anxiety. And it's just so many different things that I'm like,
Mm.
OR is not for me. I did my OR rotation in nursing, but I am one of those do as I say, not as I do type of people.
Right.
So even as a nurse, to this day, I've never been a nursing instructor to like other nursing students because I'm
Mhm.
very real world. There's a
Right.
textbook way that you have to learn to do things, but you
Mm.
will never do things the textbook way. That's just to learn it and get the technical skill and graduate. Real world is always going to be different. It's always going to be a shortcut. It's always going to be just figuring out things with whatever equipment and supplies that the hospital
Mm.
has on hand. And that's me, and that's my personality. So the strictness of OR and
Mhm.
how sterile it is just doesn't go with my personality at all.
So then, from the OR, that's not for me. Nursing is such a diverse field,
It
and like
is.
subfields and sub-fields. And tell me about your other experiences in nursing
Yeah.
too.
So when I graduated, the first thing I said was I'm going to the ICU because that's where the really smart nurses go.
Mm.
If I'm going to be a nurse, I'm not just going to be a regular nurse. I'm going to go to the top of my profession
Mhm.
because this is where we're saving people's lives. We're running
Right.
codes. We're hanging all these multiple drips. And I worked there maybe 6 months and realized this is horrible. I hate
Mm.
this. I spent 13 months in surgical ICU
Mhm.
before I transitioned to another unit because one, I did not like the surgeons or their
Mhm.
bedside manner.
Hmm.
There is this, how can I say it, this kind of environment of nurses eat their young. So you have these seasoned nurses that
Mm.
are not the most receptive or
Mm.
approachable
Welcoming. Mhm.
or and welcoming
Mhm.
exactly. So I didn't like that. I didn't like the dynamic with the family. And so I was a night nurse. I would see the
Okay.
families for about 30 minutes maybe because the visiting hours would end about
Okay.
8:30.
Gotcha.
So I didn't like that dynamic either. There were just so many things that I thought, but this is what real nurses do.
Mhm.
And I realized I wanted to have much more involvement with the family as a whole. And with the patient as a whole, I would take care of patients for weeks that were intubated that I had not had a conversation with. I didn't
Right.
know
Right.
anything about them. So it was just very removed from the type of care that I wanted to provide, even though I thought that I was going to be da 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 super nurse one save the day. I realized I didn't like codes. I didn't like seeing my really sick critical patients die alone. I got to the point where I would actually stay past my shift
Wow.
if a patient was dying just so they would not have to breathe their last breaths with no one at their bedside.
Wow.
And so I left that after 13 months and went to long-term care
Mm.
facility and
Okay.
absolutely
That makes
loved
sense.
it.
That makes sense.
Absolutely loved it.
Yeah.
Yes. And so taking care of the same patients, having that relationship with their families, pros and cons, because I would
Mhm.
know a patient so long that when they did pass, I
Yeah.
would be so upset that the family would have to console me. It's the first time I really got exposed to the social determinants of health and understanding that health is more than just when they come to the hospital for ER, SICU, or something like that.
Mhm.
Because we would have patients that were there for 5 weeks, 6 weeks. They were on long term antibiotics, right? And they
Mhm.
would do good while they were with us. And then they would go back home and they
Mm.
come back 2 months later with a gaping womb in their leg or something like that. And I'm like, okay, something is going on here. So I did that for 3.5 years. And I said, I've done night shift for a long time,
Mhm.
enough. I'm ready for Monday through Friday, 9 to 5, whatever that looks like. I just got my bachelor's in nursing. And so I went to go work at the endocrinology clinic in the VA hospital. And I thought I was going to deal with a bunch of patients that had growth hormones and
Mm.
all these endocrine conditions. And lo and behold, 80% of my patients had diabetes. And so, which blew me away. I just had no idea I was going to be just knee deep or waist deep into diabetes every single day. And then the social determinants of health really took hold, because if a patient is lucky, a patient with diabetes, they will see their doctor 4 times a year. That's it. Just 4 times a year if it's controlled. And I had to figure out a way as a nurse and as a clinic coordinator to help them manage their diabetes when they were not in the clinic, and enter public health and community health at that point. And so one of my supervisors at the time, the endocrinologist, said, Quisha, I think, and she knew I wanted to get a master's, but I didn't want a nursing master's. I'm like,
right, because that's a nursing master's is pretty common for
very,
people
very
nurses.
common
Yeah.
if you want to go into education, which I knew I'm not teaching future nurses, because I just told
You said,
I'm
yeah.
not I'm not the one to do that, right?
Right.
And there's a couple of things, but mainly education, and then also I'm a plan A, plan B, plan C type of person, right?
Also not common.
Yeah, it's like, if I lose my nursing degree, what good is the master's in nursing going to be? That was my mindset.
That's very practical.
I try to be. I try to be. So in looking for that, Dr. Agarwal says, Quisha, I think you'd like the MPH degree. And I said, well, what is that? I keep seeing it behind all the doctors, MD, MPH. MD, MPH, everywhere, every conference we went to, I just kept seeing MD, MPH. And so I researched it, and I thought, I think this will marry perfectly with my nursing degree. And I started before I even left the clinic, and the rest is history.
So when you play that out, what did you feel the MPH gave you that you were missing? Because you already had that community experience.
I knew that something was keeping my patients sick when they went home. And so it wasn't a holistic. So I say, when I got my MPH, and that's such a great question, because I always say it gave me a 360-degree view of healthcare. Because I had the inpatient bedside view when I worked in SICU and when I worked in long-term care. And then I went to the endocrinology clinic, and that was outpatient. And so I had that lens from which to see things from the outpatient standpoint. But I didn't really have the community health lens until I did my master's in public health and did all of my internships and volunteered. I volunteered at the American Red Cross, and I did disaster response. And so there were so many experiential extracurriculars I did when I was getting my MPH that really helped things come full circle to help me better understand, so this is exactly what our patients are up against when they are either interacting with healthcare or trying to manage these chronic conditions at home. So to answer your question, I think it gave me a good 360-degree view of healthcare and public health and how they're intertwined.
And it sounds like it made you a better nurse, because one of the things that is challenging in the healthcare space is when there's sort of the onus on the you're not taking your meds, you're not getting better. And if you don't have that 360 view, you put it down to medication compliance and different things, non-compliance, and things that are in directly the patient's control, but you're not factoring, do they have enough to eat at home? What are their living conditions? Do they have someone to take care of them? Are they lonely, right? What's their income situation like? And it sounds like that gave you that 360 view of a holistic
That's exactly
human being.
what it did. That's exactly, because I was really big on, this patient is non-compliant. Mr. Jones knows he's supposed to do X, Y, Z. Every time he comes in here, we have the same conversation. And I can remember almost when the light bulb went off. I had recently taken a training on motivational interviewing. So one of the things I like about the Veterans Administration, I worked at the VA hospitals. We were above the curve in a lot of areas. And so I remember years ago, because I've been a nurse almost 20 years now, when they made everybody in the hospital take motivational interviewing. Yeah. And I remember I was really like, why do I have to spend the whole day learning this? And it's not something you just automatically learn. Like, you have to keep training and using it all of the time. But I remember I was taking motivational interviewing and interacting with the client. And I had been working with this patient for a couple of years. He was coming into the diabetes and endocrinology clinic. And one day, maybe 3 months, 6 months later, after seeing him, he came in, he had lost like 50, 60 pounds. He looked amazing. And I was like, Mr. Jones, like, oh my God, it clicked. Everything that I've said, all the education I've given you, it finally clicked. And so what made the difference? Because at this point in my head, I'm patting myself on the back like, you go, Quisha, you did it. And he said, my daughter's getting married, and I don't want to embarrass her walking her down the aisle at 400 pounds. And I was like, oh, his motivation was not my motivation. Like, he knew he should lose weight to improve his blood sugars and his A1C and all this other comorbidities and complications that were going on. And so it made me see that, one, there's things that affect our clients and our patients that really have a big part in their health, but also their motivations are different based on those circumstances as well. So I started just having this awakening during that time. And like you said, it did make me a better nurse. It absolutely made me a better nurse. And I think the experience that I had as a nurse made me a great leader when I started working in health departments.
And let's talk about that. So you're very sort of plan A, plan B, planned out, looking towards the future.
Yes.
Did you know that once you completed your MPH that you would want to start going up to get to the highest level of your profession? Did the MPH change how you got there and where you wanted to land? Because, again, you mentioned that you didn't really find any passion, or it wasn't your strong suit in like teaching the leaders of tomorrow in terms of the clinical side of things. With that newfound knowledge of kind of the social terms of health and public health, did that change your approach to leadership or your strategy at all, and what you ultimately did once you were in those roles?
Oh, that's such a good question. So ultimately, one, yes, I plan everything, right? I remember 12 months before I graduated, I started interviewing for positions. And I knew, one, I'm a nurse. I make decent money. I'm a nurse at the VA. I make really decent money because VA always kind of pays higher than other hospitals. In Arkansas, I did anyway, which is where I lived at the time. And so I started looking at public health positions, Arkansas Health Department. Ooh, I'll take a 15, 20K pay cut. I started looking at places. So I knew I'm going to transition from nursing to public health. I've got to leave Arkansas. That was the first thing.
Okay.
I knew I had to leave Arkansas. And so and I say 12 months, it may have been about 9 months before I graduated. I applied to Houston Health Department. I applied in Florida. I applied in Georgia.
Whoa.
Which actually, I'm sorry.
No, it wasn't like, I'm going to look at this place. You're like, there. Was there a methodology behind?
No, I got to get out. I want to be in public health. So my long-term goal, I'm sorry, at this point, my long-term goal was the CDC as a public health advisor.
Okay.
And I knew in order to be a public health advisor for the CDC, I needed to get experience at the at the local health department level.
Right.
And so, but I knew I couldn't take a 15 or 20K pay cut staying in Arkansas. So I knew I had to leave.
So any state that would give you that was on the table?
Oh, any state.
Wow.
In the South. I did not apply.
Okay, in the South. Okay.
In the South. Yeah, I'm a Southern girl. I like it hotter than I like it cold. So I did I don't think I did Tennessee or Oklahoma, but I did those other states that I just mentioned. And Texas, HHD, they had a position. It was the chief nurse in the Office of Chronic Disease Prevention and Management, specifically overseeing 2 programs. One was diabetes and one was colorectal cancer. And from what I was told, they had been waiting 2 years on a registered nurse that also had a master's in public health that was also a certified diabetes care and education specialist, because by this time I'd gotten my certificate. So lo and behold, I interviewed a couple times, never been to Houston in my life, interviewed a couple times. They got back to me and said, hey, we cannot wait till you graduate, which my graduation would have been December of 2015. They said, we can give you to September to get here. And I rented a house via Facebook with a realtor, had never been to Houston in my life. And so 3 months. So here I am in my last semester of my MPH, selling a home in Arkansas, renting a home in Texas, doing a capstone project, and starting my first ever public health job. Yeah, it was a crazy time, but it was great. I loved it.
And you mentioned that you already had a child, and you had
2 children. Yeah. Yeah.
And then, so that's with.
That's yes. So my ex at the time, have a different husband now. Yeah. So my ex, I as we were selling the house, the boys stayed with my ex-husband, and I moved and went ahead.
Wow.
And then they came around Christmas. Yes. Yeah.
I'm okay. This is a bit of a tangent. I didn't think we were going to go here, but I'm so fascinated by this because I moved for work after I graduated because better pay, less competitive market. I was married. I had to live away for a while. I find that there's a big reluctance on new grads to do changes like that. At least in Canada, I'm not sure how it is in the States. Or it's Toronto, the big urban centers, and I don't want to move. They don't have they don't have the kind of
support.
Right. And so they're trying to get jobs in these really competitive markets, and then there's less competitive markets that they want to throw bags at them, but they don't want to take that chance and move away. So I was just really impressed that in your specific situation, you're like, yeah, this was my criteria, cast a fairly wide net in that criteria, boom, boom, moved in your last semester during MPH, did what it was.
I never been to Houston in my life.
Never been there, and you're like, yeah, it is what it is. That's very impressive to me.
You know, I'm a spiritual person, and so I'm really big in taking leaps of faith, and I'm really big in alignment. And and it speaks to, and I know we'll talk about the entrepreneurial aspect as well, but you do have to have some of that fearlessness and courageousness to be able to make steps like that. But every time I've done it, it's never, even if it's something that didn't go how I expected, there was something that I learned from it that kind of propelled me to the next level.
So you get to Houston, right? I don't know if it was a culture shock or what, because there's things outside of work that you have to adjust to. So that's one. And then there's things inside of work that you had to adjust to. So what was that experience like?
Definitely culture shock. The traffic, I had never experienced anything like it. I was white knuckled for like 8 months. And I remember at the 6-month mark saying, am I going to have to get on anxiety meds to drive to work and to drive just around? Yeah. Wow. And then just like the distance. So I lived 10 miles. It's 9 point something miles from my job. In the morning, it would take me about 45 minutes to get there. And in the evening, it would take me about an hour and 10 minutes to get there. I absolutely dreaded the traffic. And this is pre-COVID, right? Everybody's going to work every single day. So we lived there for about 5 years, and I absolutely hated it. I hated every weekend because, I'm going to go to the store. Well, nothing is just quick dollar store run, right? Everything takes forever.
It's a commitment. It's a commitment to leave the house.
Yeah. And I think if I had went in my 20s, maybe, because I'm not, Houston's not all bad. I love the diversity. You can get any kind of food you want. There's always something to do, right? It's a great, I love to go there now and visit. Like my best friends are there. I love to visit. But for me, the quality of life was not the quality of life I envisioned at that age when I moved there. And then work, you culture shock for work. As a nurse, you work your 3, 4, 12s and maybe some overtime. Or when I left the clinic, it was Monday through Friday, 8 to 4. As a chief nurse, I was always working. Maybe Sunday, I didn't look at my phone or touch my laptop. And I write about this in my book, I was in meetings back to back every single day, all day. So responding to emails and writing grants and putting my reports together and all of that stuff did not happen until I was at home, after I had cooked dinner, after I got the boys settled, that I would sit at the desk or I would sit at the kitchen table, open my laptop, and that's when I would do my work. And let me tell you, Gordon, I loved it. I was so good at it. I remember once my sister, my family came to visit us from Arkansas, and I was in the car, and I always had my department phone, and I always had my cell phone. Right. And we're driving, and I'm going back and forth, which is not good to do. This is not good to do, people. And I'm driving, and I'm going from my personal phone to this phone. And my sister is in the passenger. She was like, everybody can't, how do you switch gears like that? Because once I would come to a stop, then I would get it and I'd reply to the email. Or I would call this person, okay, you're not going to be able to make it. And she was like, how do you do that? And I'm like, I don't know. And she's like, I think you like it. And I was like, I don't know. It just came so natural to me. And I always say during that time, that was my best job. I mean, even the people, my direct reports became family because I had no family. The husband that I had at the time, we actually separated 5 months after moving there. So they became my family. They babysat my children and everything. I had no choice but to rely on them heavily. So then I had to maneuver how to be a leader with people that I've made my family, basically,
Okay.
but still be the type of leader that demands respect,
Right. Okay.
right?
Hold them
And can
accountable.
exactly. So it was a very fine balance. But I will say, in that time, I was there 4.5 years. Not one employee left. I'm talking about 0% turnover for a health department, which is really, really, really hard to do. Some of those
Well,
same
you said over the
over 4.5 years. Yeah,
4.5.
yeah.
No.
Not one direct report
Yeah,
in
that's
either of
pretty.
my two programs.
Yeah,
Isn't that
that's a long
impressive?
time. That's a long time
That
for
for a
someone
health
not to
department,
leave.
that's
Yeah.
very, very, very
Yeah.
impressive.
Yeah.
Still very good friends with everyone to this
Wow.
day. It was an amazing experience, but my issue was leadership, and I had a very my style of how can I put this? My style of leadership, especially when I am working in the community, right? And working so closely with boots on the ground, those that are working directly with our clients, is when I need something for my team or I need something for my community, I don't have the luxury or patience to wait for it to go through several levels of approval to get it done. And so I am very much an ask for forgiveness, not permission type of personality. I tend to move very swiftly. That's where I
Right.
got the nickname 90 Day Girl. So we're going to
90-day
do this for
girl.
90 days. And if it doesn't work, guess what? We're going to do another process. And even if it works, we're still going to see if we can find a way to improve it even past. So, needless to say, there was a little butting of heads between myself and senior leadership, which I never really conveyed to my direct reports. You know, they didn't realize a lot of that was happening until the end when I submitted my resignation to leave. My programs always over delivered. I mean, always over delivered. Some of the top performing programs, but I didn't feel appreciated, or I didn't feel like we got the recognition that we deserved. And I know I'm like not sleeping, working 6 days a week, doing all of this stuff. And there's a thought probably about the third year where I thought I probably could do this on my own.
You went from I did surgical. I need a boom, boom, boom. Doesn't
Yep.
work for me. It explains now in leadership. You're like, I need
Yes.
results here. I can't wait to get the
That's the word. That's
right?
results. Yeah.
results. And then now I'm like, okay, it makes 100% why she's gonna go out
Yeah.
on her own and do her own thing.
Yeah, that's when I first started getting the idea. I did start my first business during that time. I think it was about year 3. Didn't know anything about business. In a year's time, I only made $700, and that was from one speaking engagement. So I didn't do that. It was diabetes education. And then I tried again while I was still at HHD and did a partnership with 2 other women. One was a nurse, one was an RD. And so we did chronic disease education consulting. And I kept telling my business partners at the time, we need to go virtual. I think we need to do online classes. Instead of driving all over Houston trying to do these classes, we need to go virtual. Now, very few people were doing virtual online
Absolutely.
classes at the time.
Absolutely.
Pre-COVID. I'm talking about 2017.
It's like, how dare you, virtual?
Right, right. And so I was like, you know, my thought process was we're not putting enough into social. We're not putting enough into blogging. And we need to go virtual. We need to do some online courses. And there was a lot of pushback.
Of course.
A lot of pushback with that. So I ended up actually pulling out of that partnership because I had a vision of this is where we need to go if we want to move this business. And we can't afford to drive all over Houston every few months when we get an occasional contract, right? Around the same time that I pulled out from that business, I got an opportunity to go work for the state as a diabetes nurse consultant. Now, $13,000 pay cut, and had to relocate to Austin, Texas. So in debt. Husband worked a lot of overtime. New husband, by the way. So ex-husband when I first moved. 4 years later, new husband. But thank God he was able to work a lot of overtime to keep us afloat. And then again, another leap of faith. I'm knowing I want to be my own boss one day. I know I want to be a consultant of some sort. And now here's an opportunity to go work for the state of Texas as a diabetes nurse consultant. So let me go see what this really is all about. Now, what I neglected to tell you was I had done in between this time a year of a doctoral program in strategic leadership. And so I did very well for my first 2 semesters. I kind of have to do stuff to prove it to myself.
Okay.
And so
okay,
I
okay,
did it
okay.
and I was like, do I really need this doctorate? I'm like, I could do this if I really wanted it.
Right,
So
right.
I didn't finish. And my teenager was going through some stuff and
Right.
I was super stressed with the job and of course trying to relocate and all that. So I didn't go back. And so I thought, well, if I'm not going to get the doctorate, let me just get a job title that has consultant in it, because this is going to set me up even further. And so I went to go work for the state as a diabetes nurse consultant. And maybe a month in, I said, is this consulting? Like, I'm basically just using my expertise to help people develop their programs.
You thought consulting was just a different thing that you
did.
needed to get into to learn, and you're like, oh, it's just a name you put.
It's technical assistance.
You're so surprised at how
Yes.
familiar it was, right?
How simple, how
Right.
we do it every day. And that's what I tell when I'm working with clients now. I'm like, you get paid every 2 weeks. Now you're just doing consulting for your client. Now that consulting may be a whole bunch of, it could be just providing information. It could be putting a toolkit together. It could be creating a communication, campaign. It could whatever, but that is consulting. And to me, there was this big elusive, I don't know what I thought it was, honestly.
I see what you're saying.
And I literally, the programs that we had developed at the health department and that were very successful,
Right.
that saw really great outcomes in our clients and community members, I basically was just advising organizations throughout the state on how they could replicate and do the same thing. Blew me away.
Yeah.
Gordon, blew me away. I'm like, oh, this is what consultants do? And so I remember about maybe 6 months in, bored to death. I don't know if you know anything about the state. It's slow. It's antiquated. It's for me, a mover and a shaker.
Yeah. Oh, we
was
got to
di-
get this reviewed.
Oh,
and,
honey, I was dying a slow death. And I told my husband, I said, I'm going to start another business. And that's because I have plenty of time in the day. I could get my work done in an hour or two. And, and you're not supposed to do work at work, but it is what it is now. So I did. I started Umemba Health in about 6 months.
Time out. We're going to leave. That's a cliffhanger. Okay. Yeah, that's a good cliffhanger. So I actually have I didn't tell you about this segment, but we have a rapid fire quick answer segment.
Oh, yeah, fine.
That I'm going to throw your way.
Okay.
Very tame questions. Then I'm going to come back. We're going to pick back up after is this what we call consulting?
Yeah.
And then we're going to go all in on like all the stuff that we talked about before about businesses, the failure. So I really appreciate you even talking about the ventures that you embarked on, going into consulting as like being employed by a person and saying, this doesn't seem as foreign as it seemed like. So we're going to get into it. So, ready for a little rapid fire?
Yeah, let's do it.
All right. So this is our Insight Blitz segment where we ask you questions or read some statements and you'll provide a brief response.
Okay.
Let's start off. What would your career have been if you weren't looking at healthcare at all?
Party planner.
Party planner. What's the story behind that?
I'm just good at it. I love it. I thrive on it. People have just said
Not what I thought you were going to say.
I know, right? That's the only thing I can think of. It's
interesting.
I think it's because there's a lot of planning that goes into it, which I love. And exactly when it's showtime, you're ready to rock and roll. Exactly. Yeah. See, you're starting to see my personality.
I'm getting to see it a little bit.
Yeah.
What's one skill from your bedside that you still use today?
Ooh, empathy. Yeah.
That's
compassion and empathy. Absolutely. It's something that is universal and you can use with anyone in a variety of different situations. Yeah.
Interesting. That makes a lot of sense. What's the most surprising skill that public health professionals bring to entrepreneurship?
Creativity. Because if you think about it, in public health, we don't always have the best funding, right?
Yes, yeah.
and because I always said this about nursing, if the equipment and supplies were low, but I had a bandage that I need to dress, I had to figure out a way to bandage that, right? it's the same thing when you're coming up with health promotion programs. You know, you've got to meet these deliverables for this grant. You got to reach this amount of people. You've got to do, you know, XYZ interventions. And you don't always have the staff to do it. You don't always have the money to do it. But we will come up with some creative ways to get that stuff done.
Touche. One piece of advice that you'd give to your younger self when you're just starting off?
Let me see, wow. Do it scared.
Do it scared. I don't think I've ever heard that before. I know it's pretty self-explanatory, but I don't think I've ever heard that before.
Do it scared. All the stuff that I just talked to you about.
Interesting.
Moving to Texas sight unseen, renting a house via FaceTime, right?
I need to get a T-shirt printed. I need to get a T-shirt with that.
Don't think that wasn't scary, right? Leaving nursing, and people thought I was crazy. My family, they didn't know what I did until my book came out at the book launch in this March. When I left public health, they were telling people like, we think she inspecting water or going to restaurants or something. Like that's all they thought public health was. That's it. And so that was scary. When I took that $13,000 pay cut and left Houston and moved to Austin to be a diabetes nurse consultant, that was scary. But I have always been able to just do things.
Do it scared. Wow.
Without having all of the information. And as much as I'm a planner, can you imagine, like, you know, I'm a reform type A.
That's right.
Perfectionist type of person. But that's where you have to have your faith that supersedes your fear. So do it scared. Because if you fail, so what? And a lot of times, if you fail, nobody knows you failed but you.
Right. You're not like a performing athlete that missed a shot, right? And everybody says you're trash.
Right. If it doesn't happen according to your timeline, nobody knew it was your timeline but you. So, do it.
Interesting. All right, do it scared. Okay, all right. Your go-to productivity habit or tool? You must have some, or what? At least one.
Habit. Oh, my days change so much. You know, I'll just say tool, and I'm gonna put a genre: artificial intelligence.
Ooh.
And the reason that I say that, and we'll talk about what I do here and for work in a little bit, but I'll just say what used to take me 8 hours to do, I can do in 3 or 4 hours and have the rest of my day off.
Yeah. We gonna talk about that. The last one we'll finish up is a book, a resource, or anything, a TV show, movie, whatever that influenced your entrepreneurial journey, or a person even.
Let me look at my shelf.
You gotta go back in the archives there.
Yeah, influenced it the most. It wasn't a book, even though I read a lot of books. It wasn't a person because it was something I wanted to do. That's a hard one. I will say something that always sticks out, though. I will say a podcast episode. When I first thought about doing this, I was listening to Hustle. It's got the word hustle in. I can't even think of the name of it now. And she was interviewing the CEO of the student loan doctor, and I cannot think of what this woman's name is now.
Yeah.
And it was just like perfect timing because I was just about to start my business, and the CEO of student loan doctor said, I knew when I wanted to start my business, even though it was going to be a small business, I wasn't going to operate as a small business. She said, and I knew that meant I wasn't going to have the Gmail. I was going to have ... whatever my business name is .com. She said, I knew I was going to have the office line. She said, I knew I was going to have, and she just started naming off all of this stuff. Because, you know, when you're just starting, you got the @gmail.com, you don't have the website necessarily. And she said, I made up my mind when I start this business, I'm going to start it as if it's not a small business. And that was so instrumental to me because that's exactly what I made up my mind to do. And from day one, from the name to the branding to the website to the phone, everything was very intentional about, yes, I might be a solopreneur as I was at the time. I still kind of am, but I'm not going to run my business as if it's a solopreneurship. So I think that was probably one of the most instrumental things for me when I started.
Right. I love how you describe you were on your way, but then hearing that was like a point of no return for you.
Yes.
It was like, yep.
It was like go big or go home. It's almost like what it said to me. Yeah.
Okay. All right. So that brings us to the end of our Insight Blick segment.
Okay.
It wasn't too bad, was it?
No, not at all.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.